Alright, episode 10 MCQ of the day. The purpose of this episode should be that you should be able to solve any question on sickle cell anemia after watching this video. So I'll try to cover the maximum number of points and I'll try to explain maximum about sickle cell anemia, its details after discussing this MCQ. So with the help of this MCQ, let's dive in into the MCQ. What does the MCQ says? It says there is a 15-year-old African American boy, emergency department, severe onset pain in the lower back and both the legs. Okay, so we already know what is going on, that he is having pain in lower back and both the legs. So and African American boy, so this is again pointing towards sickle cell anemia. Okay, and for the last 6 hours describes the pain as a deep, constant, worse than usual. He has had similar episodes in the past triggered by dehydration or cold exposure. So this is one thing about sickle cell anemia. All these episodes are generally triggered by dehydration and cold exposure. We'll come to more about it in the discussion. But there's no fever, cough, dysuria, no recent trauma, no joint swelling, redness, and okay, so he has given the history of sickle cell disease. So he is on sickle cell disease, non-adherent to hydroxyurea, and he has a true prior hospitalizations of pain crisis also, and he has one episode of acute chest syndrome at 12. Okay, and on examination I see what I see abnormal is okay, hemoglobin is at the baseline 8.1, that's his baseline. Reticulocyte count is elevated, WBC slightly elevated, platelet ठीक है high end पे है. Or then he is asking about the management. Then what is it? Can you guess after reading the MCQ? It's quite simple actually. That what happens is that patients who have sickle cell anemia, their red blood cells, their red blood cells in small this thing in small arteries. If this is a artery, I draw an artery over here. This is a small capillary, small end artery. Okay, na? So in the small vessels, these red blood cells they sickle, that is they clump with one another. Okay, and these sickling episodes are more when there is a dehydration, when there is some stress or something like that. So many times it can be without anything also, just randomly the red blood cells they sickle. So these causes a lot of pain. So these are called as vaso-occlusive pain crisis, and these episodes they keep happening in patients who have sickle cell anemia. And so what is the examiner asking us? He is asking what is the treatment. Okay, so we'll start the first treatment. Start IV morphine and IV normal saline. Yes, this is the right treatment. And should we give red blood cells? No, there is no point in giving more red blood cells to the person. His problem is that his red blood cells are clumped. Just give more red blood cells, no problem. And administer hydroxyurea. You give hydroxyurea to prevent vaso-occlusive crisis. You do not give once the patient develop vaso-occlusive crisis. For immediate management, you do not give hydroxyurea. Hydroxyurea is a preventive drug. Then sepsis, no, he is not in sepsis. You see his temperature is not that elevated. There is no sign of sepsis over here. Okay. Abdominal ultrasound to rule out splenic sequestration. No, there is no point of splenic sequestration over here. I think in the question he has mentioned about no hepatosplenomegaly. Okay, so splenic sequestration की कोई बात नहीं होती. Instead, in sickle cell patients, there is autosplenectomy, functional asplenia, which happens by the age of 5 in most of these patients. So the right option will be you give a pain medication, you give IV morphine, and you do adequate hydration. This is the mainstay treatment. You manage the pain, you give hydration. That is the mainstay treatment once vaso-occlusive episode develops. If the patient is having more than two vaso-occlusive episodes per year, then you should start him on hydroxyurea. Hydroxyurea is going to prevent these episodes of vaso-occlusive crisis, and what is going to happen is that hydroxyurea increases fetal hemoglobin concentration. So more fetal hemoglobin in the blood, more less is the chance of vaso-occlusive crisis. Now I am going to show you some of my notes, and here you can see that these are the acute complications of sickle cell anemia. By the way, these are acute complications. So remember, this is the most common complication. Why does this keep happening? Huh. This is the most common complication and most important vaso-occlusive crisis. Okay. Yeah, the treatment I have already discussed about this. The second is that acute chest syndrome. Remember, acute chest syndrome is the leading cause of mortality also in sickle cell patients. So, what is the treatment for that? You give O2, you give antibiotics, and definitive treatment is going to be exchange transfusion if there is severe. Okay. And here there is going to be hypoxia, obviously acute chest syndrome. Then splenic sequestration, priapism is can be asked where the person is having painful erections. How do you treat? You treat with corporal aspiration and phenylephrine. Okay. Now we'll come to the long-term complication. What are the long-term complications? The long-term complications are that he may develop avascular necrosis of the femur. This is, you need to know this one. And pulmonary hypertension can be there in the long term. Long-term chronic kidney disease can be there. Okay. So these are the long-term complications of sickle cell. Now we'll come to prevention. See, preventive drug one we have already discussed, hydroxyurea. It prevents the episode of vaso-occlusive crisis. It also decreases the episode of acute chest syndrome. And how does it act? It acts by increasing hemoglobin F, that is fetal hemoglobin. And you give penicillin V in patients who are 2 months to 5 years, or you give them after splenectomy, because these patients who develop functional asplenia, they become more prone to certain infections, specifically pneumococcal infections. Okay. So you need to give them this penicillin, prophylactic penicillin till 5 years, and you need to give them vaccinations of pneumococcal, meningococcal, etc. And so what I have done is I have covered all the high yield important exam point of view topics for sickle cell with the help of this video. Keep watching this series MCQ of the day. The goal is to cover one small topic in one day. Alright, bye bye. Thank you. Subscribe to my channel, and here's the playlist of the MCQ of the day series where you can see other MCQ questions as well. Bye bye.